This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today for the last time in 2020.
Oh, thank God.
As always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm ready for this year to be over with, but this is one of my favorite episodes every year to do.
This is by far my favorite episode of the year.
This is definitely the best.
Yep. So we're going to be doing our top 5 moments of 2020, and we have a special surprise at the end. So I would highly recommend listening all the way to the end or watching.
The whole thing.
If you're able to watch this, you can find that on YouTube. It's at Jason Martin MD on YouTube, so you can actually watch the clips. If you're listening, they'll be listening. You can listen. They'll be autoing. They'll be audioized.
Oh,
you can listen to them as well.
You can listen. You can watch.
Yep, you can audio only. So they will be there. So we're gonna go in order from 5 to 1.
Yep.
I'm gonna go first because my name starts with an A, so it was only fair.
Wait. So when do we decide that you're going first?
Nils decided. Boom.
Okay.
Yes. So we're going to start with my number 5. And my number 5 clip, if you listen to our podcast a lot, you will know that we often reference music.
All the time.
So that's all I'm going to say.
Yeah, but real quick before you play it, our music tastes are basically
90s hip hop.
90s hip hop and like basically 90s hip hop.
Yeah.
Yeah.
So without further ado, here is my number 5.
All right, let's take a look.
Today we are talking about fat.
I feel like we should have Salt and Pepper say, let's talk about,
fat
baby.
Yeah. Well, if where you gain fat historically is around your waist and you have liposuction around your waist, you may not notice that creep of weight because you're not seeing it where you normally see it until all of a sudden maybe you've gained 10 pounds but don't really realize it because you're not seeing it in your waist, your pants still fit, but oh my gosh, all of a sudden your shirts are tight. Your arms look fat. So
the fat creep.
Right.
Like
and like
TLC creep.
The creep. Yeah. We're just all over We're going to use all the TLC songs today. There's going to be some waterfall stuff happening here soon too.
Oh gosh.
Before 1994, people probably had hypotheses that fat did certain things, but it had not been.
That's right at the peak of TLC's, popularity. I just want to say.
Don't go chasing adipocytes.
Yeah.
Okay. So that was all in one episode. We referenced many.
We did waterfalls.
songs.
We did creep. R.I.P. Left Eye, by the way.
Yeah.
R.I.P.
So that was, I'm like, my goodness, like when I was listening to our podcast, like how many song references are we going to make in one episode?
So I saw that episode too, and I actually thought about, man, I could get Nils to splice those all together. And I was like, I was going back and forth, which by the way, this was kind of hard to select because we've gotten better at podcasting.
Mm-hmm.
So we don't have as many times when we kind of screw up and it's funny and we're laughing,
Yeah.
So like in that sense, it's kind of working against us.
I agree.
I'm not saying that we're real good now. I'm just saying we were real bad before. We finally gotten to where we're competent and we don't have as many screw ups. So that was a really, really good one, by the way. That was I almost picked that.
I also, if you go throughout the year, the amount of like songs we reference throughout the year, like start from the bottom.
But how many people listening to this really care about TLC?
We reference a lot of songs. So.
Right.
And that's not going to stop. I feel like we did in our last episode too. So.
Okay.
All right. Well, here's Dr. Martin's.
All right. So real quick before we go on mine, I do have runners-ups. Okay, but
no, you're not allowed to. Yep. We have established this in years past. You cannot have honorable mentions.
I'm a plastic surgeon. I'm board certified. I can do what I want. Gynecomastia episode. I didn't do a clip from there, which I really liked personally. I liked the body lift episode, but I really liked the skin tightening episode where Nils throws in the boxing bell.
Oh yeah.
Yeah.
We asked. Yeah.
So and this has like nothing to do with anything. I feel like Nils should spend more time editing and throwing in sound effects. I just want to say that.
Nils is like, thank you for that.
Okay. My first one, we can watch this now, but involves Amy. Go ahead, please.
Oh, gosh.
Oh, this is a photo of you. You have to look at the YouTube channel. So this is a photo of cryotherapy, and you have to look at this photo on YouTube because it's Amy in the cryotherapy tank with some strange Tron level gloves on. Mm-hmm. Is that what they put on your hands so you don't freeze?
Yeah, you have to wear gloves. So when you
do you have to do the same thing with your feet?
Yeah, cryotherapy is dry cold therapy. So you're standing up in what is called a tank. It's like a big tube, and you walk in. You have nothing on except a pair of socks and a pair of gloves, unless you're a man, and then you have a little pair of shorts on because your man parts are on the outside. My lady parts are on the inside. And yeah, you stand there.
That's a good anatomy lesson.
Right?
Thank you very much.
I mean, we are a medical podcast.
Yeah, the best part of that is when you're explaining that the man parts are on the outside.
Man parts are on the outside.
And the girl parts are on the inside.
My lady parts are on the inside.
It's not a good episode until you say something like that.
Yeah. Yeah, that was good.
Yeah.
Yep, that was a funny one. Sorry.
I mean, the other thing is number one, you're like 100 feet tall. Okay.
Mm-hmm.
So did most people's heads stick that far out of the...
Well, your head has to be out because you can't breathe in the fumes.
Okay.
So there's actually a platform on the inside that goes up and down.
Oh, okay. Okay.
Yep. So you actually, you step in there and then the whole floor goes up and down.
Got it. And then also, did they tell you to hold your hands like this?
No, the prayer thing, I mean, like, I don't know why. That was just like what I did. Like, it's like, you got to focus.
It kind of looks like you're like, oh God, I don't want to die.
That's not it, but I will tell you.
You're not really good. What was this Cherry Creek's?
Sport and Spine.
Sport and Spine or whatever. Yeah.
Yes.
Yeah.
No, when you're in there, I mean, it gets really cold. And like, I don't know, that was just like my way of like focusing. Like we keep and your hands can be in, you got the gloves on, but like, I guess I liked it getting under my arms. Like,
yeah, you always talk about the lymph node basins. That's your.
Yep.
When Amy does the cycling of the showers, she'll take the cold water and put it in each lymph node basin, which one of those is your groin.
Mm-hmm, it is. That will actually, I don't know. I kind of like the cold.
Yeah, sorry. I do the back of my neck. I'm like, that's good enough. Yeah. I'm not doing any of my private parts. And by the way, just for all the men out there, your stuff is on the outside.
Your man parts are on the outside. In case you didn't know that. My lady parts are on the inside.
Thank you.
I taught anatomy to massage therapists.
Yeah, we've heard this 1,000 times.
They have a good education.
Yeah, we got you.
All right.
And you don't use the gluteal crease for a handle.
No,
we learned that too from your Asian
crack is not a handle.
Teacher. Okay.
All right, so let's talk about number 4.
Yeah.
Here we go. And the other thing that I stress to them too is something we do have at our disposal, which is an amazing tool, is the NAQ, the Nutritional Assessment Questionnaire. And
which I got 100% on.
Right. I actually shared that story with all the tables. I'm like, well, the first time I gave it to my doctor, he picked 0 for everything and gave it back to me with a sticky note that said, tell me I'm the best. And they laughed.
Nothing wrong. Right?
Well, that's the problem with that is that 0 is not always the right answer. And that's what I had to tell you. I'm like, 0 is not the right answer. Take it again. It
was a tricky test. It tricked me.
Right? The first few things 0 might be the right answer. But as you get farther down, 0s can be bad. So I'm like, take it again.
Yeah.
I love that too. The sticky note, like, because this was when the NAQ was still on paper, like now it's on computer.
I remember that we were over at our old office. Mm-hmm. You handed it to me and I aced the goddamn test.
Yep.
And then you came back and you were like, retake this and actually answer honestly.
Like, you have to actually answer these questions. But I'm the best, right? Like, tell me I'm the best.
Well, I mean, I'm like a ninja when it comes to multiple choice tests because that's what I did for 100 years of my life. Mm-hmm. Whenever you look at a multiple choice test, you're trying to figure out what's the angle on this question. And the thing about the NAQ is there is no angle. They're just trying to get information from you.
There is no angle.
There's no correct answer. Yeah. That's what I'm saying.
No, there is no correct answer. It's just the answer that's correct for right now. And that's.
But even when I redid it, I was still number 1.
She
told me that.
1.
Thank you.
Yeah, you were still number 1.
Thank you.
By far the most number 1 of all the people who have taken the NAQ.
Of course.
Yes. Yeah. That was fun. That was a clip from when I was at the Nutritional Therapy Conference, which was in February of 2020.
Which is so funny because like right after that, the whole world changed.
Yes, it did. Yeah. It was like the last normal trip
I took. It's funny to look at the clips from January through now and to see in a subtle way how our mood was changing. It like you could tell we were making like I'm now cussing on the podcast. Like, it's like you could just tell like at one point, like I don't know, I didn't look too good.
Well, it's because you had your haircut in like 6 months. Yeah.
Not good.
3 months.
All right. So wait. This is my next one.
You got some lead into your number 4. This is number 4.
Okay, here we go.
Number 4.
All right. So we did one on sleep. This is where this clip comes from. It's one of my favorite episodes. It's funny that if you look at our most popular episodes, they're always the ones that people, usually have things like BBL is one of them, Brazilian butt lift. But Amy and I really get drawn to some of these esoteric episodes, and sleep was one of them. So this is a very funny part.
Okay.
Do I sound like I'm getting on my soapbox
You
here?
do, but before we get any further, there is a very special, this next slide is extremely special to me.
Wait. What do you, are you pregnant?
No.
Oh, okay. I'm sorry.
No. What would that have to do with sleep?
I don't know.
Like,
You kind of freaked me out there. I
I'm
was like, oh,
preparing
no.
to not sleep for the next
she pregnant?
5 years
Is she
of my
pregnant?
life.
Does she have a COVID baby?
No, I'm
Okay.
not having a COVID baby. So you don't know what the next slide is. If you could guess one thing that like I would get really geeky about in relation to sleep, what do you think that would be?
I mean, there's a lot of things. Is it, just give me a hint. Is it nutritional?
No,
or,
it's not nutritional. It's physiologic.
HRV.
Nope. No.
Oh, darn it.
It's bigger than that.
Okay, go ahead.
So the magic of the lymphatic system.
Lymphatic system, of course.
Like the microglia.
That was on the tip. That was on the tip of my tongue.
Oh my gosh. Like, I get to talk about the lymphatic
Oh
system.
gosh.
So 2 things stand out to me in that clip.
Yeah.
One is that you were clearly on trauma call because we both had our phones.
I wasn't shaven. I had a mask wrapped around our Beauty and the Surgeon mug, which at some point we'll sell some swag. We'll get to that point where we sell it. And of course, we talked about your favorite thing to talk about, which is the lymphatic system.
I had no idea just how excited I get about that until that episode. Very excited. The lymphatic system is super cool.
Yeah. I mean, I'll admit, I tried to bring up the lymphatic system at one party, and people are like, "You suck. You're boring."
Maybe you didn't talk about the microglia
Oh,
enough.
the microglia would have made a difference.
Yes. That would have made all the difference. This is why no one talks to me at parties.
Yeah, I'm in the same boat.
That and
Until they find out you're a plastic surgeon, and then they'll ask you questions like, "Do you do breast augmentation?" Yeah, I want to say to them like, "No, I've never heard of that surgery."
like what?
What are you talking about? People augment breast? What crazy science is this, brother?
Think of the money that we made on this.
Oh my God, this could change my life. All right.
Yes. All right. So we're knocking down numbers. We're at the midway point, and we have number 3. Are you ready?
I'm ready.
Here's my number 3. Well, I think we've done justice to the butts.
Yeah.
Can I tell one funny story about the gluteal crease?
Sure.
So when I was in massage school, we had I can't remember his name right now.
Is this like an X-rated?
No, he was this little Asian guy.
Yeah.
Massage is not X-rated. I'm a therapeutic massage therapist.
Yeah.
But we were doing protocols in sports massage, like specifically for the like deep 6 for the hip
Yeah.
rotators. And he said the crack is not a handle. And every time I'm really working somebody's glutes, I think that in my mind, because like you do like the natural tendency, like if you're working with your thumbs toward the midline like this, right? Like you want to hold on like to the, yeah. Don't do it. It's not a handle.
Don't handle the crack.
No. So I felt really bad because I couldn't remember his name. And I remember going on about how he has such an American name. His name is Darwin. Yeah.
His first name?
His first name is Darwin. He's a tiny little Asian man named Darwin. So Darwin, the crack is not a handle.
Yeah. Well, after that episode, I was literally doing flank liposuction, and I laughed because I had my hand on the handle.
You were holding the crack. Crack's not a handle.
I was holding on.
Yeah. See, it's right there.
Yeah. I also like the fact that I was like, "Is this X-rated?" And you're immediately like, "God, you guys are such a bunch of dudes." Nils was thinking the same thing.
This is not a happy ending story.
Yeah.
So don't mind the crack.
Right, mind the crack.
Mind the crack.
Yeah, that was a good one.
Yeah.
I almost picked that one. Did I pick that one? I don't think I did. That was
No,
funny.
Nils tells us if we pick the
Yeah,
same
that
one.
was good.
This year we did not pick the same clips.
Okay. Are you guys ready for mine?
You're number 3.
Yeah. All right. So we did an episode on skincare, and I really like that. Again, this is probably not going to be the most watched episode, but Amy went through the basics of skincare 101. We'll do another one in the future.
Yeah. So
more
many
advanced.
more places to go.
Yeah. And then we're also going to do one for sure on stem cells in the near future too. So let's watch this one. It's very funny.
Okay. What we're not going to talk about today.
Oh
Sheep
my God.
placenta and semen facials, anyone? I also added unicorn tears. This is where everybody wants to go, right? You talk about skincare, like, oh my gosh, yeah, I'm gonna rub stem cells all over my face.
I mean, for reals though, like, is there literally a semen facial out there?
there is, yeah.
Now, okay, is that semen collected from humans or semen collected from animals? I'm just so confused about that.
Yeah.
So do
In
you
the
think?
bathtub.
Yeah. Do you think that if you put semen from whatever source or sheep placenta, that it's going to start making a big difference? It's not. That's just ludicrous. You're stupid.
Yeah.
Now, we've all done stupid things. It's okay. I'm not judging you. If it's something you enjoy and it's giving you happiness in your life, especially at this time, that's great.
The reason I really wanted this slide in here was because if you are kind of starting out in skincare,
and you
don't
just
jump to this.
Right. Don't slather $500 on your face.
Yeah.
Just get a retinol. Okay.
Right,
it's $30.
Use retinol, use sunscreen, like treat your skin well.
Please.
Yes. Like don't think that, oh my gosh, I need to do this semen facial or, rub somebody else's blood all over my face. You guys, this is the problem with. Yeah. All right. We're gonna move on to the next slide.
Yeah. That was so good. I just like the fact of that one that I was just really perplexed of the source of the semen.
Well, the whole point is
I was like, are they asking their friends? And I didn't want to say that because I wanted to be crass. This is like a medical podcast.
Yeah.
But I was like, where is the semen coming from?
Yeah, that's a good question. I mean, and it's kind of like the sheep placenta. Both of those things, the theory behind them is that they're like the base of life, right?
Right. But I mean, I'm not going to lie. I think sheep placenta makes more sense than semen.
Yeah. Because the placenta helps things grow.
Maybe that's my Puritan upbringing or something like that. I don't
Maybe.
know. So it's also very interesting too that these things things like this become in vogue. Mm-hmm. It just shows you how distorted the field of aesthetics is.
Yep.
And then
on how much we want to not age.
Right.
Yes.
If you ask me right now, if you did this weird treatment, it would guarantee you that you would not age as much. I would probably do it, even if it was someone else's semen.
Bring in the semen.
Yeah, I mean, seriously. But newsflash, semen facials really don't. I mean, in the context of beauty, semen facials really don't work.
Yes. The other thing, it's so funny to watch the clips back because that day, probably wouldn't notice unless you're watching this on our YouTube channel that I was not wearing scrubs. I had on my lab coat and a t-shirt, which luckily I had. My hair was also looking a little bit disheveled.
Yeah, what was going on that day?
That day I had a lot of blood explode all over me. So, yes. Just as a reminder, we work in a real doctor's office with real surgery and real patients.
At least it wasn't semen all over you, so.
Honestly, either way.
All right, that's good.
Change of view.
All right.
So, yes, watching the best of 2020, you get some good, inside peeks of why I was wearing a t-shirt that day.
I mean, we're real people.
Blood all over me. So before we get into our number one and number two, let's take a quick break to get a word from our sponsor.
Alrighty.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
Yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Okay. So we have numbers 2 and 1 coming up.
Yeah, it's getting serious.
It's getting serious. So here is my number 2.
So your pancreas releases insulin. Insulin helps you take glucose that's in your blood and bring it into the cells, primarily muscle cells, but every type of cell.
Yeah, liver.
So hyperglycemia is elevated blood sugars. When I was in medical school, so the biochem teacher said, it's almost impossible for someone with a normal functioning pancreas to become hyperglycemic.
Not true at all.
Totally not true.
Nope, not true.
We tested it. We were in the ER rotating, and it was like a slow night. And so
Like,
I
who has
remember
high blood sugar?
I drank 2 Cokes and had like 3 pieces of cake. Number one, I've never felt so terrible in my entire life in a very short period of time.
Right, that's like 200 grams of sugar.
Oh, it was something insane. And we measured my blood sugar like in 15 to 30 minute intervals, just a blood stick or a finger stick. And it definitely went over 100. It went up to, per memory, like 125.
Yeah, I wouldn't be surprised if it maybe would have even gone up higher.
Yeah.
So I couldn't help but like picturing you like sitting back in the ED, just chugging soda and eating cake.
Oh, I felt like I was going to die.
Puking into a red bucket later.
There's so many things that we did. And it just shows you how like a group of losers we are. Like people are actually out going to concerts, having fun, doing whatever they do at that age. And we're like sitting there like eating cake and drinking Coke.
Well, I mean, thinking of how much faster, I mean, like, if you drank the glucose stuff, I mean, like drink a couple of those, like the ones they actually give you on the test.
Yeah, that was the idiot part. We could have gone over to radiology, got the GI lab or whatever, and got the glucose stuff.
So gross.
Yeah, but like it wasn't just the sugar; it was the volume of what I put in so quickly. Yeah, that was fun. What episode was that from? I don't even remember that.
What episode was that from? Now I can't remember.
That's okay.
We were talking about the immune system.
Yeah,
because we were talking about the immune system. Yes, because we were talking about the blood sugar dysregulation, how that affects immunity.
So, quick question on this. This is only about the immune system. So, this vitamin D in the immune system. Do you feel, as a nutritional therapy practitioner, that low vitamin D levels are really affecting people's immune systems?
100%.
Okay.
Yep.
So, for most people out there that don't live in sunny states like ours, you would recommend they take vitamin D for their immune system on a regular basis?
Even people at our longitude latitude, essentially, because we don't get a lot of sun.
Yeah.
And anybody who's north of Colorado, oh my goodness, like they absolutely need to be supplementing with vitamin D, probably year round. Like in Colorado, you can get away with supplementing vitamin D in the winter, but in northern states, unless you are spending a lot of time in the sun during the summer, you probably are not getting enough to boost your levels.
So put down the Coke and the cake and start taking some vitamin D.
Appropriate amounts.
All
okay.
Right. So it's my turn now.
It's your number 2.
Okay.
This is where I make a joke about me being your number 2.
Yeah. Well, who does number 2 work for? We've done that every year for the past 4 years.
Never gets old.
I know. I mean, but I think it's old to the people listening. Maybe. All right. So this is not as funny, but this is one of my favorite episodes, rhinoplasty.
Oh, good one.
Yeah.
Okay. So we're talking about the nose. We're talking about rhinoplasty.
So rhinoplasty, one of my favorite surgeries to do. It's one of my favorite surgeries in general for plastic surgery. It's definitely the hardest surgery we do. I trained in New York City. This was like the apex of training when you started doing rhinoplasties or nose jobs. Everyone, like if you take the person that knows the least amount of plastic surgery, they know a nose job and they know breast augmentation. Like
Right,
those are
those
the
two
two, and
things they know.
liposuction usually too. Those are like the three things. Like, do you do nose jobs? Do you do nose jobs?
So this is where, if you're watching this, you get a really special treat because Dr. Martin drew these pictures.
Yeah, who's that artist? That guy's pretty good.
Right, he's good. You didn't sign them. You should have like signed it like right under the nostril. Right?
It's all about empowerment.
It is, and don't be afraid. Like rhinoplasties get kind of a bad rap.
They're awesome surgeries. If you go to someone reputable, they do a conservative approach, natural, you're going to have a really nice result. It's going to be subtle and nice. It's going to be additive to your face. It's not going to take away who you are. It's going to be additive to who you are. That's what it's all about. And that's where those fine detailing, this millimeter at a time, makes all the difference in the world. There's a little pressure on the surgeon. That's the hard part. If you take off 2 millimeters, which like look that up, it's like nothing. And you only should have taken off 1, you'll know it. So you really don't have a lot of wiggle room with rhinoplasty.
That was such a good episode.
Yeah. And to have Nils edit it down, I wish he could do all parts of my life like that. He just made us sound really, really good.
I'm going to pick the good parts. I'm going to fade
I
in
think we
and
should
out
just
some
do like a
pictures.
Facebook ad for our practice with
Just that.
Yeah.
Yeah, that was very good.
Yeah. And so one of the reasons why that was one of my favorite episodes is that's when we got out of quarantine. And that was one of our first episodes when we got back together, you and I and Nils.
Mm-hmm.
Yeah. And that was why that was so important to me.
Yeah, that was a really good one.
Yeah, that was hard. When we went through that, kind of doing basically one of my favorite surgeries, doing that episode on that was good. It was well received. It's not our most watched episode, but it's definitely one of the higher watched ones.
Yeah. Well,
And listened to.
Yeah, our original rhinoplasty podcast was one of our top listens ever.
Yeah.
Yeah. Okay. The moment has arrived.
Oh, this is hard.
I know. So it's the number one clip for all of 2020. We didn't quite have 24 podcasts because we skipped. So 22 podcasts that we had to choose from.
Huh.
Yep.
What did we skip?
We skipped in October sometime. Only because we were waiting. I think it was actually to release. Was it to release the rhinoplasty podcast? Why we skipped a week? Yeah. To like make it like we wanted to shout out to our sponsor. So yeah.
Yeah, because we got a sponsor.
Timing.
So we
Oh, yeah.
get all that
Yep.
adjusted.
We didn't talk about that. 2020, we got a sponsor.
Yeah.
Big time.
Yeah. Well, so they've heard that already. They heard our sponsor. Let's get checked. Everybody should get checked.
Let's get checked.
Let's get checked. Okay. So without further ado, the number one, and then we have a surprise. So here's my number one. As of the beginning of 2020, there was a total of 377 what they considered unique incident reports of BIALCL, Bill.
Real quick on this, you said 300 and something cases, then it says 733 unique cases. Where are you getting that 300 from?
I don't know what you're talking about.
Dyslexia.
Did I say 373?
Yeah.
See?
You said 377.
Three. See? Nils knows. Nils sees the dyslexia. You can never trust me when it
How
comes
can we
to
be experts?
numbers.
You gave the wrong number.
Well, I gave the right number in my head. So the number is 733, not 377.
Oh
if
my
you
God.
think that dyslexia is not real, have you met me? I just realized if you go back a couple podcasts and listen to us talking about my glasses wearing, I'm starting to feel like I'm like giving up all my flaws to everyone who listens. Like I can't see.
You can't do math.
I can do math.
What do you actually bring to the table?
I'm so dyslexic. It's painful.
I'm starting to wonder
we're gonna start picking on you one of these
the
days.
value equation we have. Listen, I'm a surgeon, Amy. I'm a surgeon.
I write numbers down.
That's so good.
So yeah, that was my dyslexia on full display.
Yeah.
And I am so appreciative that Nils actually pulled the clip of me saying the number backwards. I said,
I mean, you literally said it backwards.
well, I switched the 3s and the 7s completely.
Yeah,
Just completely.
completely.
Yep, completely switched them.
That's like some beautiful mind stuff right there.
Yeah. I mean, it's so, the OR is so, what I call the scheduled surgeries, like I have to give them like CPT codes, which are a 5-digit code of the surgery. And like, oh my goodness. I mean,
Yeah.
and phone numbers, they're just used to me saying numbers all kinds of backwards and just getting used to it. So.
Well, I can, validate your intelligence. You're extremely intelligent. So I guess this, you gotta it can't be perfect. You can have parts of your brains that don't really work that well.
Yeah, the part that knows numbers.
But then it's weird because you remember phone numbers like verbatim.
Yeah, I don't know why.
Yeah.
It's like it doesn't make sense.
Yeah.
It's a weird thing.
Kind of cray.
Yeah.
Yeah. Well,
So,
we love you.
If I can see the numbers,
Yeah.
if they're really close to me, I can maybe say them correctly.
Yeah.
Yes.
All right. My number one is not as good as that one, but it's still very funny. We talked about breast enhancement without implants. It's actually one of our most watched and listened to episodes. And that was good because we kind of laid out the fact that breast enhancement without breast implants is not what everyone thinks it is. I mean, it's beneficial to some people, but not everyone.
Yeah.
But you said a few funny things in there. Hold on.
Okay. Now I'm nervous. Let's talk a little bit about magic creams and other promises.
Oh my God, I didn't even know you were doing this.
Yeah. So I
Are we
think
going to talk about brasiers too? Like
like push-up bra? No, but I think every young girl probably saw or has heard at some point, like read ads in a magazine back in the day, or had, someone's older sister.
I know I did.
Tell them about this like magic cream, or like you rub mayonnaise on your breast and it will make them grow.
I'd rub mayonnaise on my breast.
Right? To make them grow?
Yeah.
Yeah. Like there are all these like things that you hear as a woman, so topical creams, like this will make your bust grow. Like all these things will do magical things for you. And then my favorite to help strengthen and tone the breast is bench press. And yes, women, you can bench press. So on the back of my shirt, it's going to be bench press ladies. On the front, it's going to be squat ladies. So, so you can, but by building the pecs, you are going to help improve the appearance of your overall chest.
Yeah.
Is it going to replace a breast lift? Like, absolutely not. But it can certainly make your chest look better.
Yeah.
Without making you look bulky. You will not look bulky. Like you can bench press as much as you can, and your chest is not going to be bulging out of your shirt.
I mean, depends on what you're taking.
If you're taking some drugs with it, then you might. But, really.
We've seen that.
Yes.
Yeah.
I mean, all of these other things, as much as we'd love to say that, we have a magic treatment that if you rub this lotion on, you're going to increase your breast size.
That's how you get hits on YouTube. We have a magic treatment to make your breast bigger.
This cream. Mm-hmm.
Some special lotion. I can't believe you didn't come up with something that was holistic and some root.
No,
That's like so your style. It's like acacia berry rubbed on your breast. No,
nothing? Chaste berry is not going to make your breast grow. Like, no, will not.
That's one of my favorites. Because number one, it goes through the whole gamut of you. Number one, you're talking about mayonnaise rubbed on your breast. Like, what in God's name does mayonnaise?
Oh, who knows? Probably the fatty acids. I don't know.
Yeah, okay.
The egg yolk.
Right. And then
all that choline.
Yeah. And then we go on, and you rightfully noted that you said put the bench press on the back and the squat on the front. So you were dyslexic. You should have flipped that around. Mm-hmm. Squat on the back, bench press on the front for the t-shirt. And then we throw you under the bus related to nutritional therapy and some roots that you could find that could make your breast bigger. Mm-hmm. That was good.
Yeah. That was...
I know.
All the Amy-isms came out in those.
I love it. But then I have my cap on. I look like a complete idiot. Like, why didn't I take my cap off?
Oh, because we'd been in surgery that morning. So you can tell because my hair is so slick.
I had head probably. Yeah.
Like I take mine off because it like slicks my hair back so good.
Yeah.
Like,
Well, the kids,
my hair so slick.
The kids call that stunting. I think I was stunting.
You were stunting.
Yeah.
Yeah.
Trying to show people I'm a surgeon. I should just go to Whole Foods with my cap on.
I mean, you got the shirt.
Yeah.
Yeah.
If you don't know what I do, just look up top.
That's right. I'm a surgeon. I'm a surgeon.
Well, this podcast would not be, but would not be entertaining without you. Like you are literally the reason why I actually can tolerate watching these episodes. It's hard when you hear yourself, but just seeing you, you're so fun. You're so eloquent. You say so many good things, and then you always spice it in with an Amyism.
With a semen facial or some mayonnaise.
Yeah, mayonnaise on your breast.
Mm-hmm.
We could go further with that. We're going to stop there.
Numbers.
Yeah. Okay.
So the special thing that we have is I actually asked Nils to pull a clip, his top moment from the year.
Oh, I love it.
So I figured this year, more than ever, we appreciate Nils every year, but this year especially, having to be Nils for 2 weeks, I will tell you this, I made a terrible Nils. It was terrible. I was nervous. The camera angle was weird. The lighting was bad.
And I'm not throwing her under the bus because if I would have done it, we wouldn't have had any audio or video.
Yeah. So I did my best, but the 2 episodes that we had to record without Nils were really a struggle. So I'm like, we need Nils to give his top because he is absolutely as much a part of the podcast as anybody.
He is. Yeah. I invite anyone to watch or listen to our podcast and then go listen to other podcasts or watch other podcasts. And it's unequaled. Yeah. Nils is so gifted, so amazing. He gives us a platform and makes this possible for us to reach a lot of people, which, by the way, we established Portugal,
Yes.
Norway. I mean, what were some of the other countries?
Obrigado.
Like we're ranking.
We love you.
We are ranking in Portugal.
Yes, our one Canadian listener. We love you too, Heather.
Even though the Portuguese will not let Americans into their country because of COVID, it's someday I will go to Portugal and I will meet you fans there.
We're going to bring all of
And
our...
the Norwegians. I went to Norway. I love Norway.
Bring our Beauty and the Surgeon swag. So
Yeah.
this clip is a surprise to both you and I because Nils picked this clip.
Okay,
This is
I love it.
Nils' top moment of the year.
Okay, good.
Nils' number one pick.
Nils' number one pick.
Yay. Thank you all for sticking with us. If you made it through those last 2 episodes that were a little rough from an audio standpoint, we really appreciate you hanging in. And clearly we're back to being socially distanced with Nils, but he is here. So
Nils is here and he looks like a barbarian. He came in, no haircut. I mean, things are growing
Big
everywhere.
beard.
Oh my gosh.
Yep. I don't know how he gets all that beard in the mask.
It's not good. I feel sorry for Sarah, your wife.
Oh, I think Sarah gets down with
If
the
you
Nordic.
see Nils
Yeah.
and he's coming at your child, he's not going to try to take the child. He just hasn't gone to the barber yet.
Yeah, werewolf over there should not be talking.
That was so good. That was so good.
Seriously, I mean, your hair, you made it look good on video, but like your hair was like,
Yeah.
pretty much a disaster by that
Yeah,
point.
I can't explain what Nils looked like.
There was a lot of
He's
hair.
literally what's your native country?
Norway.
Norway.
Okay, so Norwegian. That's
Yeah.
what maybe that's why we're ranking high over there. You didn't tell me that.
They sense the Viking.
Yeah, he has go watch that show Vikings. He has that kind of hair color and that kind of coarse hair, and his beard looked like he was going to chop your head off.
Well, he had hair coming. I mean, he just has a lot of hair.
Yeah,
Nils has a lot of hair.
yeah,
It was impressive. He has since trimmed it in.
yeah.
Yep.
He's looking good.
Yep.
He's looking
You've
presentable
gotten a haircut
now.
since then too.
I have too. Every time I go get my haircut now, I tell them to cut it as short as possible, and they're like, why? I'm like, because I'm afraid things are gonna get closed down again.
Never know when I'm coming back.
And so you always feel so bad because you're speaking to the proprietor, right? So you're telling them their business may get closed down, but I'm like, pull out the razor to shave it off.
Make it tight.
Yeah,
Oh, it was, as much as it was challenging to pick clips, it's always so much fun to go back and listen. And it's funny to watch clips in succession like that because
Yeah.
I feel like you look the same in every one. I mean, you had your surgical cap on in one, but I have like the episode, I had that lipstick on because we were taking pictures that day. That was before COVID hit. I had bright pink lipstick on in one.
Yeah.
Sometimes I got the flower.
yeah. You bring the
Sometimes my hair is
you bring the
down.
sauce.
I know.
You bring the
Sometimes
sauce.
lab coat. Sometimes it's cold in here.
Yeah, I had my suit on one time.
Yep, you did.
So I was in my closet looking at my suits, and I'm like, I don't think I'm ever going to wear these again. The one thing that this problem and pandemic has caused is like, I really don't want to wear suits anymore, and I may not.
Yeah.
And I think people are going to be cool with that.
Yeah. Yeah. It has definitely changed things. So
Suits. You need like a-
Yeah, I need a surgical
The
sweatsuit.
swoot.
Yeah,
the swoot.
Yeah.
Swatsuit. You just swoot.
yeah, with the headband.
Wrist sweatbands.
Yeah.
Yeah. So we so appreciate everyone listening and bearing with us through some weirdness in 2020.
Yeah.
We really appreciate your likes, your comments. We had 2 episodes where we answered your questions, so please keep the questions coming. You can leave us comments, ratings, and reviews. Those things all really do help us. We want to keep bringing information that's educational and helpful. And like we noted, it was almost harder to pick clips this year because they were so educational that they were long, big clips.
Yeah, we're getting way better at this stuff, so it's not making it as entertaining. We don't have flubs that Amy and I really enjoy.
No.
The one thing we can tell you is this year, even through all the pandemic and all the difficulty, our podcast has really grown from an analytics standpoint, amazingly well, way more than we ever thought it would. And we're, obviously we have a long way to go. We're the little engine that
We're
could.
still a baby
Yeah,
podcast.
but we're passionate about what we're doing. We love doing this. It's a great creative outlet. And most importantly, we get emails, comments, replies all the time telling us that, hey, this podcast really helped me for going through this surgery. And these aren't our patients. These are people all over the country and in Portugal and Norway. So
flyover happening.
Yeah, that's okay.
Yeah,
You think,
incoming.
Maybe the vaccine's getting dropped off?
Maybe.
Okay.
Maybe that's what that is. Hopefully. Airdrop.
I got to go.
Yeah.
But we want to thank everyone for listening and everyone for supporting us. And please pass our name around. We want to keep growing. We want to keep going.
We do. So
Okay.
cheers.
This is what we do every year.
That's
Even though
right.
I'm right-handed, I'll do
I
this like
know.
this. Cheers.
Thanks, everyone.
Bye.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.